I gave birth in July 2015. The next morning, a woman came into the room where we were in with our baby with a clipboard, and I recognized her as a social worker. I remember her saying that someone from public health would follow up, but the way it was positioned was like it was like a courtesy, like, you know, we're just looking out for you, and a public health nurse will follow up when you're home just to check in on you to make sure you're okay. And I thought that was odd, but I was tired. We had a new baby. There was so much going on that I didn't really get the chance to say, why are you here? What made you come? Why are you here? Why do I have a social worker here? Because in my mind, I'm university educated. I work in the hospital. It's not like I'm here by myself. I'm not like a particularly young mother. I'm 35. So what happened? How does that make me feel realizing that Black children are overrepresented in care, and that I could have had my son taken away? That breaks my heart. I didn't even think about that. I never thought about that. Until just now. And knowing that could have happened, like, that actually makes me really angry, because I did everything I could to make sure I was healthy and to make sure my baby was healthy.
I used to work these night shifts at a group home. And, you know, even though it would be late sometimes, and I'd like fold the bed out and be lying there. And I remember just having thoughts of, you know, how could I die? And like, it's so hard to even talk about now. I remember just having thoughts and thinking about how can I die and like leave the least impact possible on those around me. But I think something that is really important to take note of, like on the Black experience, is that Black folks don't often get the opportunity to just be individuals. It never felt like I was just making decisions sometimes individually for myself. It felt like I was always thinking about what's going to reflect positively on my community. I was fortunate enough to win a large scholarship going into my undergraduate studies. And at that time, I noticed that I was feeling very exhausted. You know, I hadn't formally been diagnosed with depression or anxiety, but I knew that I was feeling very fatigued. And I don't think that people often would think about like highly successful or driven or ambitious people as people who also were dealing with their mental health. And at that time, you know, my father had recently lost his job, and I still have a younger sister, but I was thinking about how were my parents going to pay to put two of us through school. And so I started university slightly burnt out, and I didn't have that language at the time to describe it.
I have never felt supported by the Canadian healthcare system. I've had to figure out ways to advocate for myself, create my own medical team and plan, and find pockets of support. I don't even know if I'm recovering from traumas that I've actually experienced as a survivor of child sexual abuse, or if I'm here recovering from the traumas I experienced trying to get help through the healthcare system. I went to a doctor 25 years ago just for help to be a better mom, because I did not want to start smoking again. And they put me on antidepressants without explaining to me what these pills would do, what the side effects were, what the causes may be. I wasn't even diagnosed with anything officially yet. It made matters worse. I was in a semi-catatonic state when my mother had to take me back to his office and say, fix my child. I was in my mid-30s by then. But the reason why she was so concerned is because I was also a mother, a wife, an employee, a government employee, but I wasn't doing anything. I was stuck underneath the dining room table for at the time what seemed like maybe a couple of days, a couple of hours to me. But it was almost a year. I'd lost my all that time. My then 9 to 10-year-old child, yes, that's how much time had elapsed. Having to bring me food underneath the table where I would sleep and force me, beg me to eat. She would go to school in the morning and tell me, I'm going to school to do this. And she would come back home and tell me all about her day and force me to eat. It hit me hard back then too, but it made me even go closer into that shell because I felt like I was failing as a mom.
When Black women speak about experiencing pain in the healthcare system, they're often not believed. It's like we're not supposed to experience pain or that we're exaggerating. We're just not believed. When I was feeling a lot of pain and I asked the nurse, I said to her, I'm in pain. I'm really having a lot of pain. And she just looked at me blankly. And I said to the nurse, I really have to pee. I can't go. I need a catheter. And so when she came back and emptied, I guess, the bag with the urine into the bottle, it's like a liter plastic bottle with a handle, took it up and looked at it, and it was full. It was completely full. And the way that she responded, I realized this woman didn't even believe me. And in my opinion, I think she didn't believe me because I'm Black.
I kept going back to this doctor to ask him again, please help me. But this time, I couldn't even speak for myself. I was a zombie. And as I was telling the doctor in very gruesome details what I was remembering, why I was stuck underneath that table, why I suddenly became afraid of everything, he told me, that sounds like some white shit. That sounds like some white people shit. You're a strong Black woman. You need to get over it. They just kept prescribing me more and more drugs, more and more needles, more and more. At one point, I was up to 18 prescriptions.
I was assaulted 8 years ago, and I'm still healing from it. The true impact of having experienced the sexual assault that I did and how it interrupted my studies, I don't think anybody really understood the degree sorry.
The advice that I would give to Black women is to advocate for yourself, speak up. If something doesn't seem right, speak up.
It's the healthiest I've ever been. But I still can't give credit to the healthcare system here in Canada for that.
Whoever is watching this video, that you really take the time to listen to Black women and you take the time to listen to survivors and you think about how we can shape a world that would have people want to stay in it, not feel like their only option is to take actions to have them leave it.